Well, a warm welcome to today's talk, Monday the 11th of April. Now, symptomatic cases in the United Kingdom are just starting to come down now, but still very high, still around about the 4.5 million mark. And the mystery as to why BA2 Omicron especially has not spread throughout the United States hasn't really been answered yet, but we're going to look at some reasons why that might be. But also it looks like there's some indications that the cases in the United States are just starting to rise now. And I want to look at the bizarre ongoing zero COVID situation in China, where people are really suffering now. I've had some direct communications from China, which I'll be reading out anonymously, of course. But let's look at some background information first of all. So this is the number of confirmed cases. Now, we know that this is inaccurate in the United Kingdom, but it's an interesting guide. So here, for example, this line here, this is the Netherlands Omicron spike. So they've come down from a really high one there, bit of a BA2 bounce and down quite a lot. India, United States, down. India basically doesn't exist now. Infections not being reported there at all. In fact, may well have pretty well gone. That could be fairly genuine. Australia, we see, still fairly high. New Zealand, that's the blue line there, starting to come down. So that just gives us some interesting indications. Variants, of course, all Omicron. Omicron is now completely globally dominant. Hopefully our world in data will start giving us BA1 and BA2 soon. That would be interesting to have that differentiation, but I know they're limited as to how much data they can present. New numbers of COVID patients in hospital per million. Well, United Kingdom, well, no question it's high-ish. Now, it's not unmanageable at the moment. And a lot of these patients are actually admitted with COVID rather than for COVID. Probably around about half and half on that. About 50% are incidental findings, maybe slightly higher. But it does seem like hospitalizations have probably, we would expect, peaked in the United Kingdom. I really hope that's the case now. But Canada, okay, slight increase. Australia, slight increase. Netherlands going down. In the United States, still going down. And I did check on the very latest data from the United States just before we made this recording, and the hospitalizations are still going down there despite a slight increase or intimation that cases are just starting to increase. Now, what's this? This is intensive care. So patients in intensive care basically have gone down, I think we could just about say everywhere. Really, Canada, they went up slightly, but there again, Omicron was probably slightly later. So intensive care patients gone down pretty well everywhere as Omicron has arisen. And that is remarkably encouraging, partly due to the lower pathogenicity of Omicron, partly, of course, due to the pre-existing immunity. And daily COVID-19 deaths, that just gives us a bit of comparison. India, basically, they're not being reported. Canada, Netherlands. Australia, they do seem to be genuinely down in Australia, which is good. United States, they're way down on what they were. United Kingdom up slightly. Germany and New Zealand slightly higher. And roughly, in the UK at the moment, roughly it's about 70% of these deaths are due to COVID and about 30% are incidental. So that's just a bit of background. Now let's go and look at this really interesting situation in the United States. Just made a few notes on this here. So cases are still low. Down about 1% as BA2 has become dominant. Now, as we've just said, there's been a slight increase in cases in the United States, but BA2 has becoming dominant in the United States for some time now. So why haven't we seen this BA2 Omicron surge that we've seen in European countries, in the UK, for example? Well, the original Omicron was so contagious, the situation was predictable with Omicron. And actually, perhaps the Omicron situation has been the time that this pandemic's been most predictable because it was so contagious. As we said, as soon as we learnt about it, we knew it was going to become globally dominant. So that was quite predictable, whereas the earlier waves were less predictable. But the BA2 has made it slightly unpredictable again. So let's be clear about that. There's unknowns. There's a lot we don't know. And everyone admits that, of course. Now, there's more immunity in the United States. Now, the United States, people looking at it from the outside are really somewhat bemused by the political or the politicization of the pandemic. And it's actually coming through in the statistics now. So liberal parts of the United States had high vaccination rates, higher than some parts of Europe, very high vaccination rates. Conservative communities, normal life for some time with much lower vaccination rates. But now they're both having low levels of new disease. Now, this indicates to me that there's a lot of immunity that's been generated by natural infection and by vaccination, perhaps more immunity generated by natural infection in the conservative communities. How this will fare in the longer term isn't yet clear. Of course, people in the more liberal parts of the United States, the Democratic areas, they've had higher levels of vaccination, but then they're still going to catch Omicron as well, so they're likely to have hybrid immunity. So both of these immunities should really be quite good. But of course, the serious point here is where the vaccination rates have been lower, there has been higher death rates. And I think the data on that is becoming quite clear now. Now, this particular data I got was from New York Times. So I don't know really what its political position is, but that they are clearly saying that there's been more deaths in conservative areas, although now the BA2 is low in both areas. So interesting. I suspect the hybrid immunity, which is probably more common in the liberal areas, will be equally good to the more natural immunity, which is more common in conservative areas. I know I'm simplifying a lot, of course, but it's going to be an interesting one to watch longer term, that's for sure. BA2 has recently become dominant variant in India, South Africa, and as we've seen, other parts of Africa like Uganda, and BA2 dominant. And yet the cases, the symptomatic cases are way down in those places. So little doubt really that there is a lot of community immunity developing, and those countries do illustrate that. And we saw Rivera talking about this as believing that the Omicron provided a lot of natural immunity in Africa, which of course we're pleased to hear. Now, this is from Andy Slavitt, former Biden COVID advisor. BA1 has infected 45% of Americans, he believes. So 45% of the entire population have been infected by BA1. And of course, this is going to give a lot of cross immunity to BA2. So very high levels of BA1. Could that be why we're not seeing the BA2 bounce? That is one possible reasons. Fewer tests, of course. It's just sometimes simply not being picked up. It's as simple as that. Uninsured people must now pay for tests, so testing's not being done. In other words, we're getting a big discrepancy now between infections and diagnosed cases because people simply often can't afford to pay for the testing. So fewer tests being done. But I think the main factor there is that BA1 generated so much immunity because it just spread throughout the whole country. Because levels of protection in the United States, social distancing were relatively low, so BA1 just spread through the whole country, 45% of the total population infected, or have been infected. And you could certainly argue that that's a good thing, because that has generated a huge amount of natural immunity in its wake, which we could argue about, but you could argue that that is a good thing. Many clinics for testing have now closed, just another reason why there's limited testing. So this is Jessica Rivera, Boston's Children's Hospital. Quality of current COVID data in the States, she believes, is abysmal, which probably is true. So we are dealing with a lot of variables that we don't know, but the hospitalizations are remaining low. So really the infections don't matter at all as long as the hospitalizations remain low. And the BA2 on top of the BA1 immunity, on top of the earlier Omicron, on top of the Alpha, on top of the Delta immunity, on top of all the vaccine immunity, and the hybrid immunity that the BA1 and the BA2 are generating, all really make for a fairly optimistic picture in the States. So are we still going to see a surge? I think we probably still are, but hopefully it's not going to be a big one. But let's talk about other informed opinion. Dr. Scott sorry, I can't pronounce the name. I won't try. Dr. Scott, a former F.D.A. commissioner, some parts of the country dramatically underreporting cases. In other words, there's a lot more infections than cases, but that doesn't really matter if it's not transposing through into hospitalizations. In fact, you could argue it's a good thing, because it's generating, people are getting infection on infection, generating much more immunity. And if they're not getting sick, then that's probably okay. The reason I'm saying probably okay, the slight proviso there is long COVID. Is there going to be more long COVID as a result of this? And that's one of the unknowns. We're hoping not. The early indications is it's not huge, but we really don't know. We don't have full data on that yet. Trends covered of hospitalizations lack current trends by about a week. So basically, we would have known by now, and we're not seeing the increase in hospitalizations. We're not seeing that, which is really, really quite good. Well, very good, remarkably good news. That's the whole thing. As hospitalizations in the United States have continued to fall. So what's my best guess? I still think US infections will rise soon as BA2 spreads, because other places have had a BA2 bounce. Don't see why the United States should be massively different. Okay, there's a lot of BA1 pre-existing immunity, but of course we did have that in other countries as well. Was there more of that in the United States? Probably there was. So I am expecting a bounce in the United States, but I'm not expecting it to be huge, and I'm really not expecting it to be associated with high levels of hospitalization, but I am expecting it to be associated with large levels of developing community stroke herd immunity. Now, I was going to go and look at the UK now, but I've gone on a bit there, so I think we'll leave that one there, and then we'll re-record. We'll do another recording for the UK one. So thank you for watching the US update.